Good evening, everybody, and thank you for joining our workshop on End Violence Against Women, Preventing and Responding to Violence Against Women as Global Health Professionals. So we are celebrating today the UN Day for End Violence Against Women. So this is a wonderful workshop that we have prepared for you here, and we've got three excellent speakers here joining us to provide their perspectives on this issue and the amount of work that they've done across the world and within the UK, and the kind of things that we can do as future global health professionals, current global health professionals, as human beings on this issue as well. It's quite a packed agenda. It's from now till 8. There will be presentations by 3 people. So we have Vanya going first, and then there will be Morma, and finally Joanna will give us a great perspective of this issue. So I don't want to give up too much. There's going to be lots of interaction, so please feel free to use the chat box to put your thoughts in about the various questions and cases that will be presented today, and to also raise your hand using the functions that you'll have on your participant/chat box. Word of warning, we have experienced before some Zoom hacking difficulties, so if anything like that happens, we will end the meeting probably a bit early, so fingers crossed that does not happen. So please don't share the invite link to anybody else, but thanks for who are here already. Okay, so without further ado, I will hand over to Vanya, if you want to introduce yourself and kick us off today.
Thank you, Chatra. Hi everybody, my name is Vanya Kibui, and I'm really excited to join you here today. It's 9 p.m. in Nairobi, so good evening. So yeah, today marks the first day of 16 days of activism, and as YACT, we're really excited to get engaged in any kind of activation and online work, conversations that promote the advocacy and the activism around ending all forms of violence against women. So I lead the policy advocacy work at YACT. And the first bit of the presentation is basically who we are. But my background is I'm a lawyer by training. I specialize in public policy, and I've been working in public health policy, specifically sexual reproductive health, for the last maybe 6 years, but generally in governance and civil society work for the last 10 years. So I'll just go straight into my presentation. Why is it not? Oh, great. So this is who we are. So YACT is a movement organization. We are about 2 things. We are about meaningful youth engagement and capacity strengthening, and our focus is on young people. And we focus on advancing gender equality and sexual reproductive health and rights. We are completely youth-led, youth-driven, and so we are, when I say 100% youth, it means our staff is youth. Maybe I'm the oldest because I'm turning 35. Our advocates, youth advocates across the country are youth as well. Our membership organizations we work with are youth. Even the organizations that we subcontract for designing or other products we want to develop are all youth. So our focus is to provide a voice, skills, and participation platforms for young people, a platform where young people can find a common voice and relay their priorities to decision makers, providing and strengthening the capacity of youth advocates and youth-led organizations to engage in advocacy communications, and campaigning on their priority advocacy topics and participation. How do they work to increase resources and increase youth representation on decision making, and increasingly from government priorities to practices? How do you get your foot in the door when it gets to agenda setting? So that's what meaningful youth engagement is all about. So we amplify youth voices, and this is what our membership looks like. We are about a little over 3,500 advocates across the country. 49% are females, 46% are male, and 5% other gender orientation. Majority are between 18 and 24. And so our definition of youth is 18 to 35 because we go according to the Africa Youth Charter. Although, as we know, in our political class, there's 55-year-olds who are still youth, but we strictly stick within that. And we are completely, should I say, youth-led, local-led. And so you can be a member of WIACT as an individual youth advocate or as a youth-led organization. And our organizations are about 779 right now. And we really get excited when female-led grassroots organizations are part of our memberships, and they're a bit higher at 50%. We are all over the country. That's in the 47 counties. So before WIACT was set up, what we did was really engage youth across the country to see the kind of issues they'd like to engage on, and issues of interest that would then design or formulate our advocacy. And these are the 4 areas, five topmost interest to young people. And that's health, education, gender equality, and employment. So programmatically, we do work on health and gender equality, but in our partnerships, we have addressed all these key areas, including employment. So when it comes to, as I said, we have 2 approaches. That's advocacy capacity, and meaningful youth engagement. So for advocacy skills, what we have is that we developed, I like to call it a cool learning product, because I was part of developing it and deploying it. But it's an online curriculum on advocacy, youth in action advocacy training. So it is designed for Kenya in terms of the context, the world rather, can go through it and really be able to develop their own advocacy strategy. So what it helps you do is, it's made up of 9 modules that look at the advocacy strategy process. So one thing is that we notice that a lot of young people, or anyone who hasn't done advocacy, you know what the problem is, and sometimes you create a solution that is really not the solution, or you are advocating to a decision maker who's not the decision maker for your issue. So, and you're working on an issue, or you're going it alone. So this curriculum helps you kind of go through all of that, kind of murkiness of figuring out what it is you want to advocate for and developing a strategy around that. So it looks at accountability, looks at communications and campaigning, resource mobilization, because we are really passionate about grassroots youth organizations being sustainable and thinking of other alternatives, alternative sources of resource mobilization, and documentation and evaluation. How do you tell your story, even as Students for Global Health? There's so much you're doing. How do you tell the story behind what you're doing, and what are you engaging on? And then we also have a module on the budget cycle and the policy cycle. It's really useful to know what kind of policies do you want to engage, when are you engaging in them, and what kind of change do you want? And is financing a thing for you? As you will see, for even working on violence against, eliminating violence against women, financing has been a very big issue, especially in Kenya. Anyway, so this is a cool product that's delivered through blended learning. It was completely co-created with young people, so we would get, even our peer learners are young as well, so it has animation, stories, games, and graphics. So right now we've had about 134 youth go through it, including 50 from 7 different countries in the country. It's completely open source right now. So as long as you have access to internet, you can go to yactmovement.org and enroll yourself. If you're really interested in advocacy, it's a good place to start. So the other approach is meaningful youth engagement, as I said, in terms of having increased participation of young people. And so what we did was co-created a scorecard that kind of it scores the engagement for by young people and by policymakers, but focused on specific policy issues. That's online as well. We're currently piloting it, actually not in 4 counties, in 5 counties. Great, so this is everything we were doing. Oh, actually, I should say before we get to this, programmatically in Kenya, what we do is using the curriculum, we work with youth advocates so they can self-identify an issue they care about and then develop their own strategy on that. And so there were several policy issues we were working with, or we're working on, including sanitary towels, or I'm forgetting management of sanitary towels, and developing policies around that. We have youth-friendly services. We're looking at sexual and gender-based violence policies and how they link to teen pregnancies, including sexual reproductive health under youth policies and all of that. And these are different policies in different counties. So we were busy doing all of that, and then COVID-19 happened. And as all of you know, the ripple effects of this pandemic affected everybody, but it severely affected poor and marginalized communities more, especially vulnerable groups, such as women, youth, and children. So what the pandemic did was that it exposed a lot of existing gaps in all our communities, whether it was in access to justice or access to food. And so we kind of a lot of structures that have a link to sexual and gender-based violence kind of collapsed for a bit there. So like in Kenya, there were the fissures in our healthcare systems were exposed, the fragility of our economies as well, access to food, access to clean water, which in turn amplified the impacts of the pandemic. So many of the effects of the pandemic, as many analysts have said, have not, as you've seen, they have not necessarily come from the direct impact of the disease itself, but from the other kind of shocks, socioeconomic, even in terms of social-cultural justice and governance, and the disruption caused by pandemic and the different government responses that governments went to look at. So before I go there, I want to have you, so I'll stop sharing so that you can join me in this and share my screen again in this Mentimeter session. So let me just move this here. Great. I hope you can see. Can everybody see? So go on your phone and to your browser and type in www.menti.com and use the code 2739418. So www.menti.com and put in the code 2739418. And when you go there, just type in whatever comes to mind. And the first question is, I have 2 questions for this. The first one is, what comes to mind when you hear about gender-based violence? So we'll just give you time. We'll only go to the second slide after we get some responses. Oh, cool. A word cloud is coming together. Inequality, no voice, oppression or oppressive, physical, injustice, heartache, pain. Thank you so much. Inequalities and women comes out huge. Thank you. Long-lasting ramification. This is true. Patriarchy, yeah. Power dynamics, oppression, disgust, no escape, yeah. Sexism, hurt, children, mental health, social norms, no voice. Thank you. Oh, we still have some more coming. Yeah, coercion, systemic sexism, I hear that. So inequality looks like the biggest, I would say, word that resonates with everybody. Thank you so much. You've had 15 respondents. Oh yeah, I see unfair, silence, exploitation, yeah, domestic violence. Thank you so much. So allow me to go to the next slide. So what in your community has been the impact of COVID-19 on gender-based violence? Just like the first one, any answer works here. The best thing is that it's anonymized, so. Loss of funding, an increase in the rate and lack of support, this is true. Thank you. Increased violence in your communities. Do not move that plug here. A huge rise in domestic and intimate partner violence. Thank you so much. Increase in SGBV alongside decrease in social safety nets. Yeah, increased significantly. Increase in mental disorders, incidence of GBV, people isolating and not having a reprieve, an increase in domestic abuse due to lockdowns. Thank you so much. For those two, and as I continue with the presentation, you will see that when you do this kind of reflection and when you go through the presentation, that the causes and the causes of GBV in terms of what comes to mind, in terms of the overriding thought on gender-based violence or violence against women, and this in terms of the impact of COVID-19 haven't been that different just because you are in a different part of the globe. So thank you so much, guys, for championing this. And I'll share my screen again so that I can continue with the presentation. Sorry, I'm trying to. Oh, great. So what happened in Kenya, like many countries, is that GBV quickly became what we're calling as the shadow pandemic, because gender-based violence cases and child development cases worsened, or there was just this spike due to COVID-19 responses. And every country kind of used the same, okay, I guess other than Sweden and New Zealand at some point, in terms of restriction of movement, advisories to work and learn from home, social distancing guidelines. And in the country, in Kenya, we had partial county and area lockdowns, which means there were certain counties you couldn't move into. And there were just like police, should I say, checks. And you would need, I don't know, a letter from what government official to be able to cross. And then there were nighttime curfews. For us here, it started at 7 p.m. At some point it was 9 p.m. At some point it was 11 p.m. And then now we're to 10 p.m. And there's this running joke about whether COVID-19 goes to bed at night because of the number of times they kind of changed that. But I think even as a government, they've been trying to figure out what to do. So since then, there's been a very steady increase of SGBV cases, sexual gender-based violence cases. So between 25 and 42% since March, because the first case of COVID-19 was announced on March 11th here. And then also during this time, the cases go into court, almost 40% constituted of sexual offenses cases. So in January, so these numbers, I should say, are from the, should I say, government hotline, and we all know that GBVs are underreported, as some of you shared on the word cloud. So in January, there were 50 cases reported. In February, there were 62. In March, there were 106. In August, there were 646. In September, there were 810. And I don't have the numbers I didn't add the numbers for October and now November, but as you can see, there was a steady increase. And then we still had other running factors. There was a flood here, and I think there's another country so where there was a flood. So we had about 12,000 women and girls displaced by and affected by floods. and needed GBV-related services, because as we know, it's like when the social structure kind of crumbles, women and children and minorities and vulnerable communities suffer the most. Then there was the issue of access to sanitary towels. So with the closure of schools, what happened in Kenya is that the girls who need sanitary towels would usually get them in school. And then now you're home. And not only are you home, the income has reduced. So it becomes an issue as to whether should we buy sanitary towels or buy food. So then there was, should I say, a risk, because of period poverty, there was a risk of like continued vulnerability, because now girls would have to find a way to get sanitary towels, including sex for pads, and sometimes there was violence involved. And then during the pandemic, with the closure, with the lockdown and everything, we had over 400,000 girls at risk of FGMC, female genital mutilation and cutting. And then, as we talk, one of the what responses on the word cloud was about lack of infrastructure. So the need for rescue centers way outshot the demand, the supply, because like in Nairobi, which is a very populous country, I think we had one government-run rescue center. So why am I talking about it, or are we talking about it in terms of gender-based violence? So I know today's we're looking at violence against women as an International Day, but gender-based violence is more of an umbrella term. It describes the type of violence linked to gendered identity, whether you're a man, woman, or other gender identity, and the socially constructed roles and behavior expected or allotted to that gender. And then there is inequalities, and you saw the biggest word that was coming up in a word cloud was inequality between genders, where the disadvantaged gender is rendered vulnerable and dominated and exploited by the more privileged or powerful one. And I think this is what sometimes we're talking about when talking about checking your own privilege, is looking at the disadvantage or the vulnerability from somebody else's perspective. And this domination now is symptomized in what we end up seeing. What we end up seeing is the violence, but the inequality and exploitation would now show up in limited access to, social services like health, education, security, nutrition, and continued victimization. And when you look at the structures during COVID-19, people were not, I don't know about in the UK, but here in Kenya, there was a drastic reduction in people accessing other kinds of services. And there was even statistics saying that maternal mortality would even go up. And then there was stigma, because a lot of reports from abroad was like there was the most of infections were happening within facilities. So people didn't want to go and then catch the virus there. Or if you go to a facility, there was this fear that, you would be diagnosed with it. And then, as we said, schools were closed. Insecurity was a thing, and even in, I don't know in the UK, but in Kenya, even police were, a bit brutal during that time as well. Those lack of food security and all of that. So the causes, similar to how some of you have responded, there was reduction of income. So there's a lot of economic insecurity, unemployment, as I talk about floods, and food insecurity. So there were several studies done at that time, like a rapid research, to kind of really be able to quantify the impact. And one of what we did with WIACT was with young people across the country. And young people reported significant negative effects on mental health and economic and social status. 50% said there was a reduction of income, 22% said, almost 23%, complete loss of jobs. There were those who were experiencing more stress and lived in fear, and some even reported an increase in crime in their neighborhoods. And then at this same time, there seems to be a spike of teen pregnancies during COVID-19. And the reports that we have at that time was that, like, one county was reported about 4,000 teen pregnancies during that time, 200 of which were by girls under the age of 14. Now, the thing about this number, it's huge, and teen pregnancy is a big scourge in Kenya. But analysis done by different organizations demonstrated that the number of teen pregnancies in 2019 around the same time was even higher than now. Just going back to the way that the pandemic made us, it created this pigeonhole through which we looked at things, and everything was like really magnified. So what did we do about it? So as I said, we are a network organization, and our power is in our movement. And so we partner with a grassroots organization called Tunawiri and launched this awareness campaign called Zuia Zogo. So Zuia Zogo is a Swahili word, and Zuia is like prevent, and Zogo is like conflict. So stop the conflict or prevent the conflict. Just basically raising awareness on sexual and gender-based violence. We had some key asks. Sorry, I feel like my voice is going. We had some key asks, and we're looking at protection for survivors and rescue centers, accelerating the hearing of SGBV cases in court, once reported, training of healthcare workers on handling these cases during the pandemic, and taking action at a national level to end the rising cases. And this included a demand for SGBV response to be categorized as an essential service or essential health service, and by doing that, allocating funds, COVID-19 funds, to address this as well. So just to say that at that very high national, at the government level, we didn't get the kind of quick response that we wanted. So I would say the wheels of justice were very slow to move, but we continued on, and we had between 20,000 and 5 million impressions at that time, and these were the highest for us since COVID-19 had struck. So essentially what we were able to do is this campaign ended up being a conversation starter. And so we had an online petition as well that ended up getting almost 900 signatures because we used our online presence and mobilizing our youth. So we do have, I have a quick video that I wanted to be able to show you. It's 2 minutes on, yeah. Oh. I hope you'll be able to hear it from your end.
Hey, Vanya, we can't hear the sound.
Oh, you can't hear the sound?
No. Do you want to send us the video link in the chat? Then maybe we can watch it
yeah.
At the same time.
At your own time, yes. So I could do that, yes. Okay, so then I'll just go back to my presentation because I will. One minute, guys. I'm sending it just now. There you go. You can watch it in your own time. I have several, so I'll just send them to you, Chaitra, and everybody can watch them at their own time. But basically, those are videos showing the conversation around what our asks were. What our asks were at the time when it came to the campaign. And so at that time, there was a lot of online conversations, but because we were a conversation starter regarding, this, what needs to be done and the demand for action, we're able to partner with young parliamentarians through their association, Kenya Young Parliamentarians, and held 2 online sessions talking about this. And they're called Tubonge Live. So bonga is slang Swahili term for talking. So come, let's talk. And so we got, should I say, really good response, even from members of parliament who ended up attending. And there were some great commitments that had us present what the demands were at that time before the Women Parliamentary Association, and also before one of our accountability bodies in the country on gender inequality. So gaps still do exist because COVID-19 just, it's been raging on. And we continue to have healthcare workers and police officers who need to be oriented and trained. Access to justice has been a challenge because some courts are closing. And then the reluctance of many survivors to officially report violations, citing fear. We have inadequate access to sanitary towels, and this number is growing and also contributing to teen pregnancies. And because communities were kind of driven to themselves, and so this kind of formal way of dealing with SGBV kind of communities kind of went underground. And that addressed FGMC in terms of female genital mutilation and cutting, and also traditional court systems that kind of shun going to court and all of that, because, as we know, when it comes to GBV, like in Kenya, the statistics, almost over 90% of gender-based violence perpetrators are familiar to the victim, and only 6% are stranger violations. So this kind of access to justice thing is a very big hindrance. So I know I'm presenting to provide, students who are going to be healthcare providers. And so some actions I thought of in terms of you all being advocates, providers and advocates, is one, to keep the conversations going and maybe start the conversations. So raising awareness and demystifying myths and misconceptions around SGBV and break down SGBV stigma. As the first question on the Mentimeter was, what comes to mind? So the good thing about reflecting on what comes to mind is that you're able to see where you're at as an individual when it comes to sexual and gender-based violence. And then even if you're at, an okay place where you get it's a violation, you get these laws, and you're clear about the pathways for reporting and the pathways for rescue, you also get to see how other people see it and what areas of interventions you can engage in. And I think it's starting with you is a very good place to start, especially having that kind of conversation on such a day where we're talking about eliminating violence. You could just, kind of slide it in there in a conversation with a friend or a family to see where it's at, and act and get resources that help you have those conversations responsibly. And also the second one is building movements, joining or working with local grassroots organizations or action groups, and pushing for response measures and accountability, including funding and allocation. So I'll say this, I've worked in public health for about maybe 7-8 years now. And one thing I saw is that it's only recently, like for instance in my country, that healthcare providers were trained to be advocates, like demand for things to happen. This is because you work in a system, like the healthcare, a system that is already like stewarded by the government. And so ideally you expect things to work. I know COVID-19 kind of exposed some things, but in a system where you only get to the symptoms only come to you, not the symptoms, the effects. You only get to see the effects and don't get the symptoms. You don't get to really understand what the clamor could be. But we have seen that having doctors and other healthcare providers working with us as advocates has a huge impact on the changes that governments listen to, because I don't know if it's the same in the UK like here. A lot of Kenyans believe in two people, and like there's two, should I say sources of truth, and that's their religious leader and their doctor. So here it's a big deal if your doctor kind of says. So it's kind of, I don't know how, I'm looking for the English word for that, but I hope I communicated it. The next one is healthcare, in terms of recommending training of healthcare workers and how to respond to SGBV cases, and advocating for well-resourced SGBV response and infrastructure, so that if they don't have, if victims can't get to you, they can get to a rescue center. And then pushing for a legal framework that works. And most of us do have legal frameworks attending to violence against women and SGBV, but the issue has been implementation and addressing all forms of violence against women. So that's it. Any questions?
Wonderful. Thank you so much, Wanya, for that. That was a wonderful presentation and really showed all the work that you guys have been doing on a local and national level, and now sort of sharing that information with us globally. If there's any questions that anyone has, please feel free to write that in the chat box or to unmute your mic and speak up. If not, do send us questions and we will forward them on to Vanya. If you are still here till the end, Vanya, you can feel free to answer them then. But I do understand it is quite late in in Kenya at the moment.
Yeah.
Okay, so just give a minute or so for people to think of any questions and to write them in the chat. But in the meantime,
they could even tweet the questions to us through this as the conversation goes on. That's our Twitter handle at YouthActKE. That's our Instagram. That's our Facebook. That's my personal Twitter handle, and AMREF Kenya. So we'll definitely see your questions and we'll respond even if not within this time. And please feel free to go to our website. You're going to see all this work we're doing. Thank you.
So we have a question. So is there anything being done in Kenya on this issue that we should be looking into, looking to implement in the UK?
Oh, that's interesting. So I think rescue centers is a big thing that for us is a very immediate need. So number one, I'm sure you have, I think you already, in the UK, you already have call centers, right? I've seen something like that, right? So you have call centers, so that's being done. And then there is the rescue centers. So in fact, I feel that maybe we should do more in terms of that and pushing for financing. So I think that in the UK, just like building movements that are multi-sectoral, like what we end up doing here because of the need, gives you like great results because you're able to reach a wider scope of people, and you're able to demonstrate the impact of gender-based violence from healthcare perspective to a legal justice perspective to a social issue and all of that. So keep having the conversations. I can't say that we're doing this better than this other country because as you've seen, the need is still very high. But I know that the campaigning and the conversations and kind of trying to push the envelope on that is useful. Is there another one?
I've got one more. You mentioned a bit about teen pregnancies increasing a lot during lockdown. Looking to the future, do you think there are any direct ways to bring them down anytime soon?
Wow. So it's interesting because one of the big campaigns that WIAC launched last year is called the Sauti Sasa campaign, like speak now or voicing the issue now. And last year, by the time we're launching the campaign, the government had called teen pregnancy a public health issue. So the problem we are having with, or rather the we are having is that many of the should I say, actions that have been taken to address teen pregnancy have been very, should I say, singular, right? And yet it's a multi-sectoral thing. So one of the things that we are pushing for, so what we did also is, by the time we launched the campaign, is that we reach out to young people, like we usually do, and ask them what they think would make sense for this. And we have several asks, and one of them includes not having teen pregnancy just a one institute issue. So for instance, it's not a Ministry of Education issue, it's not a Ministry of Health issue, it's not a parents issue, it's not this teenagers issue. So young people said they want a wholesome, like a holistic way of addressing this. This includes getting young people the education and information they need from schools, training parents on how to have those conversations, making sure they get access to sanitary towels, making sure they get access to healthcare services and strong referral systems. So those, I think, in the very big future, when we adopt that kind of multi-sectoral engagement, it would help protect girls from teen pregnancy, and also having conversation with boys and girls. So another thing we're also doing is getting influencers involved in the conversation, including male influencers, whether they're rappers or, other kind of MCs, and having a guy talk about, period poverty. We found has been very impactful. So those are some of the strategies we're planning on using. And I don't know, check with us in another year if maybe in one county teen pregnancies have dropped, maybe it'll be something.
Thank you very much. We'll just take one last question that's just come up. Is SGBV a large talking point in the media in Kenya currently, given the large increases seen over the last couple of months?
Yes. Actually, I'll be honest, teen pregnancy was bigger than SGB, which is why a lot of us were yelling. You almost had to really yell and shout and say that sexual and gender-based violence should be something. So it is talked about, but then there's also normalization of gender-based violence, especially domestic violence, because you have communities where women actually are led to believe that discipline is your husband's way of showing he loves you. So it's like there's a lot of, should I say, social cultural barriers to go beyond. We can actually be talking about solutions. But yes, it's talked about. It goes in and comes. Organizations working in sexual gender-based violence are everywhere in the country. We have people running their own rescue centers. So it's definitely something that different partners are responding to.
Amazing. Thank you so much. And thank you, everyone, for those wonderful questions as well. I think just be keeping aware of time, we will now move on to our next speaker. So we have Morma on this to give us a little bit of information about the work at SVRI. Morma, do you want to take the floor and if you just let us know when to go to the next slide, we can move on to the next slide for you.
Okay, thank you. Hello, everyone. I am Moma Muremi, and I'm the admin and knowledge manager for the SVRI, and I'm joined by my colleague Lisa Lutz, who's the partnerships and forums officer. So on behalf of the SVRI, I would like to say thank you to the organizers of this workshop for inviting us to engage with you all. And before I share a quick summary about the SVRI and the work that we do, I would like to find out how many of you in this call know of or have heard of the SVRI before. If you don't mind, can you please turn on your videos, and by a show of hands, just indicate if you've heard of the SVRI before or not. No? No? Oopsie. No worries. You will hear more about us today. And if you've got any questions, please feel free to type in the chat or raise your hand. So can you please move to the next slide, please? The next one, actually. Sorry. Please move back. Just go to the previous slide. The previous slide, please. Can I share my screen? Will I be able to put up my presentation?
Sorry, yes, I'm experiencing some issues, so we can make you host.
Okay. Thank you. Okay. Can you all see my screen? Thanks. Okay. So firstly, I would like to provide a brief introduction to the SVRI. We were established in 2003 as part of an initiative working to address the 1090 gap, where less than 10% of the worldwide resources devoted to health research are put towards health in low and middle income countries, where over 90% of all preventable health problems worldwide occur. We work to increase research and research resources on violence against women and violence against children in low and middle income countries. We do this through building evidence, strengthening capacity, promoting partnerships, and influencing change. So every 2 years, we host the SVRI Forum, which is a global research conference on violence against women and violence against children, which we hope all of you will attend our next one, which will be held in Mexico in 2022. So now I will show you a short clip of our strategy, just to give you an idea of who we are, our vision and mission. Enjoy. Can you hear it? No? Okay. Sorry, let me reshare.
The SVRI has made a huge difference in putting issues of violence against women on the public health agenda and in supporting research from low and middle income countries.
Thank you. So through our strategy, the SVRI strives to build a field of researchers and stakeholders working together to develop better, cost-effective programs and services to respond to survivors compassionately and effectively to prevent and ultimately end violence against women and violence against children. So as mentioned before, we do this through our 4 strategic goals, which includes building evidence, strengthening capacity, promoting partnerships, and influencing change. So in the next few slides, I will walk you through some of the activities that we do at the SVRI. And firstly is we build evidence through various activities, and this includes supporting and funding innovative research in low and middle income countries. We manage the UN multi-country study database for secondary analysis. So if you would like to analyze the dataset as part of your post-grad research, please reach out to us and submit a proposal. All of the information required is available on our website on the links included on the screen, presented on the screen. We strengthen capacity for quality and policy relevant research and practice in various ways. And this includes mentoring young and emerging researchers from low and middle income countries as part of the SVRI forum. We offer bespoke training to our grantees, and also in the next coming year, we are looking to launch an online research training course. We strengthen capacity through sharing resources via our website, which we refer to as the Knowledge Hub, because it consists of recent resources in the field. And we share these via the SVRI update, which is our weekly emailer. And if you are not a member of our listserv, I would like to encourage you to sign up to the listserv. Liesel, please post the link to signing up in the chat. We are also available on a social media platforms such as Facebook, Twitter, Instagram, and LinkedIn. And we use our help desk as a platform to link people and also to share resources and information about what's happening in the field. So in order for us to understand, to expand our understanding on the complexity of violence against women and violence against children, and how to prevent and respond cost effectively, interdisciplinary research collaborations and partnerships must be fostered. So we organize and convene the SVRI Forum every 2 years, which provides a global space where delegates build knowledge, they expand their network, create new collaborations, and share knowledge and key decision makers in the field of violence against women. So the SVRI Forum also provides a platform for new and emerging researchers to interact and share information with experts in the field. As mentioned before, our upcoming conference will be in Mexico in 2022, so please save the date. And we also organize gatherings, including online virtual events to foster collaborations, to foster collaborative solutions to complex problems and gaps in the field. All our virtual events are available on our website, so you can catch up by clicking on the link that's provided on the slide and also in the chat. We are seeking to strengthen and share knowledge, skills, and tools in the fields with researchers, particularly in low and middle income countries, to implement sound research and ensure that research can support advocacy efforts and influence policy and practice. So we influence change through a number of research priority setting activities, including a global shared research agenda work, and also the regional priorities setting work, which focuses in the Middle East and North Africa, and also Latin America and the Caribbean. We are also involved in a research priority work on the intersections between violence against women and violence against children. We currently we have a call for applications. We are seeking the services of a qualified consultant to support a consultative process and to guidance on ethical funding for violence against children and violence against women in low and middle income countries. You may be asking yourself, how do we involve or include young people in our work? So in 2017, we partnered with the University of Bedfordshire's National Center on a project called Being Heard. And the project aimed to promote the active and ethical engagement of young people in research on sexual violence. We brought together a group of young researchers from low and middle income countries to engage and share their research with experts in the field at the SVRI Forum 2017. So this video will just show you a highlight of what happened throughout the project.
I'm heading to my fencing class.
Not sure what happened.
Meu nome é Mariana, eu sou pesquisadora do Centro de Defesa dos Direitos Humanos de Criança e Adolescente.
I'm from Zimbabwe.
The Being Heard project is focused on facilitating meaningful and ethical participation of children and youth in research and in participating at conferences.
There are a mix of cultures, languages.
Incredibly creative and innovative and passionate, and so it gives so much hope for the future.
I feel so wow, it's like I'm dreaming.
I'm happy to be in Rio on the conference of SVRI. It's very nice.
Being heard is more than a sojourning voice seeking for home in a ear. It is more than an individual pilgrimage, more than a soul's longing for acceptance. It is a youth revolution.
I'm so passionate about children,
working with and for the empowerment of women and girls.
To be a part and parcel with children in order to help them and rescue them.
Should we actually say all sessions must have a youth voice?
Maybe you just need to teach me how to be confident enough to put up my hand and speak about certain things that hurt me or things that I know.
Day 2 of the SVRI Forum 2017, and it's been amazing.
It's day 3 at the SVRI conference here in Brazil, Rio.
I'm sure that all you have your words of praise to put on the canvas.
Leandro, can you tell us what your word is?
My word is encourage.
Então, acho que essa sessão, diferente das outras, ela nos toca
mais profundamente, né?
The graffiti session nailed it.
To participate as a group in a social and artistic activity. That was amazing.
This is the last day of the conference. I enjoyed it very much.
Mi amiga
Laura.
Mi amiga Laura. Yeah.
I've got to meet new people, I've got to learn new stuff, and I'm surely going to incorporate some of the things I've learned back home.
Yeah, right now, preparing for a presentation.
Então a gente está tentando representar por meio da nossa performance as diversidades possíveis e a necessidade da gente entender que nós somos iguais e
deixar uma mensagem de que de fato nós temos diferenças, né? Nós somos diferentes, mas temos muito mais coisas que nos unem, né? No sentido de que a gente é ser humano.
The Being Heard Project has worked with 10 very talented, diverse researchers from around the globe. They're community researchers, they're activists, and they're really an incredible experience, an incredible part of this movement.
I raise my voice and tell them, encourage me at least.
If I go far, I'm not sure I'll find my way home or get lost. Will you keep an eye on me?
Empowerment is more than just an opium for the oppressed souls. Empowerment is a real need.
The world can be better with youth participation.
The country can be better with youth participation.
No consigo comer, no consigo dormir, no consigo pensar.
Hi, girl.
Yeah.
Thinking like maybe making some quantitative data on
numbers.
on prostitutes.
I mean, you have like 2 or 3
Yeah.
friends who
They can
buy
come with us
like-
and
Help me.
What?
Help me.
Help you.
we're not social workers. We're
Help me.
researchers.
We're from academia.
And maybe we can record.
Help me.
To help her. Probably we should work with her and work for her community, not help her.
Smallest bird can sing from the tallest tree.
Make sure that, people at least are in the know of, the diverse cultures that the other people come from.
These methodologies they use sometimes in the plenaries, in the presentations, are very traditional methodologies, and that's really a barrier for young people to engage with the information that's being presented there.
To reduce on the complexity of the words.
They are bringing their research with the short forms. For example, I've seen IPC, but I don't know the meaning of IPC.
I think there must be more efforts on have translations in all panels.
Take in as much as you can as far as information is concerned.
Don't lose hope.
bakole bye balina okukola bayigirize abantu abavubuka bye bayize.
Learn something new each and every time you attend a conference.
You are somehow impacting people that you don't know yet.
Thank you. So a lesson learned from the Being Heard project is that nothing without us, nothing for us without us, rather. So it's important for researchers to include young people in conferences and also in research studies in a participatory manner. How do I move to the next slide? Sorry about this. Oops. Okay, so if you're interested in a career in this field, you can become a member of the SVRI and receive a weekly roundup of news and information on research and opportunities that are available for young people. We would also love to hear from you, young people in the field. So if you have a thesis that you are working on, we would welcome a blog post submission. And so be on the outlook for our upcoming conference. There will be calls for applications for young professionals program. So please keep an eye for that. And we provide great resources for students and an opportunity to learn more from seasoned researchers in the field. So in conclusion, there is no direct link to studying a career in the violence against women and violence against children field. But there are different institutions that offer courses on gender that may help you that may help you to explore a career linked to these fields. Also, you can write to experts in the fields by looking for their contact details in publishing journals. Thank you. Do join us on social media platforms, follow us, and we'll follow you back.
Thank you so much, Mom. And I think now we all know a lot more about what the SVRI do and the amazing opportunities that are there available for the youth as well. If anyone has any questions, please feel free to put them in the chat so we can answer in the live. And I'll just give you guys a couple of minutes to think of any questions if you have any. So we have a question. Are there any emerging research priorities in relation to the pandemic or your work right now?
Yes, definitely. So as I've mentioned that we are involved in various activities with regards to global shared research agenda setting work. There are emerging research priorities, and we will share the findings sometime next year. And these will be available on our website and also shared via the SVRI update and also the SVRI social media networking platforms.
Oh, so keeping us guessing you are then. So we won't know yet, but we will soon. Okay, thank you. We have another question, which was, what can research programs run by institutions in high-income countries do to be more ethical when they do research in low and middle-income countries?
I think the first thing would be to work in partnership with researchers based in low middle income countries so that you don't impose your own, how can I put this, your own thinking on what's happening on the ground in the low and middle income countries. So hence at the SVRI, we emphasize that researchers from high income countries partner with researchers in low middle income countries.
Amazing. Thank you so much, Maura. And I definitely hope that there will be a lot more partnerships. And now that you've put across research that you've started and the team has started within within the areas where people are going to do work, we can maybe do it other ways. You provide us with opportunity to come and work for you instead of us being the other way around. So I think that's also a very good way of doing that. And I think people who have joined today who are based in the UK will definitely find it very interesting to work the other way around than the usual things that you come across?
Yeah, definitely. Please do reach out to us.
Brilliant. Thank you so much.
Okay.
And I'm glad to see that there are people here who are from various countries. And again, thank you for being still awake and engaged, even though it might be late where you are, or late everywhere. So without further ado, I will now let Joanna introduce herself and provide a perspective from Plan UK. Joanna, are you able to share your screen?
Yes, I will do.
Okay.
Let me. Can you see that? Oh, wait, sorry.
Yeah, it's nearly there.
Has that worked?
Can't see anything yet.
Oh, no.
Okay, there it is. We see the lovely pink and blue.
Oh, brilliant news. Okay. Okay, I'll crack on. Hi, everyone. I'm Joanna Shepherd from Plan International. It's great to be talking with you all this evening. And as Chaitra said, thank you so much for staying engaged when it's fairly late in the evening. I really do appreciate it. And also just great to be here to mark the International Day of Elimination of Violence Against Women, as well as the start of 16 Days of Activism to end gender-based violence with you all. I am the Policy and Advocacy Advisor for Protection from Violence at Plan's Global Hub, and I'm based in London. I am going to be talking specifically about protecting girls from violence today, and when I kind of give a bit of background about Plan in a second, you'll probably understand a bit more why. But first, just to introduce myself, I have been working at Plan for 2 years in policy and advocacy. Before then, I worked in children's rights at national level in Scotland in monitoring and advocacy there, and also completed a master's in health inequalities and public policy at the University of Edinburgh. So very familiar with the work that you do as Students for Global Health. I'm very happy to be here. In terms of a background on Plan, I'm happy to share more information if that's helpful, but Plan is an international NGO working in over 60 countries globally. We work in both development and humanitarian settings, and we primarily work on advancing children's rights and gender equality with a specific focus on equality for girls. And the reason for this is quite a few years ago now, Plan undertook some research and kind of evidence collection and identified that girls were a demographic that were being quite overlooked in programs and interventions. And this is for a couple of reasons. Firstly, they kind of fall between the gaps of classic interventions aimed at women and those aimed at children. And secondly, the period of kind of childhood and adolescence for girls is incredibly critical for their development. And it's where we see the kind of entrenchment and embedding of gender inequalities that cause kind of lifelong consequences for girls and women. And so Plan's strategy is now to work to advance gender equality, working with and for girls as well as boys and men. But that is where I'll be focusing my presentation on today. So just to let you know. And if you have any questions, obviously at any point, please do feel free to post in the chat. So just to start off with talking about the scope of the issue a little bit, I've just put some stats up here just to kind of give a bit of background on how adolescent girls experience gender-based violence, and I'll be using the term gender-based violence throughout this presentation. So if we start in the top left, the lifetime prevalence of intimate partner violence among 15 to 19-year-olds is around 30%, which means that 15 to 19-year-olds surveyed globally, 30% of all have experienced at some point violence by an intimate partner. 1 in 5 girls globally was married before the age of 18. 200 million women and girls alive today have undergone female genital mutilation of some form. The UN estimates that an additional 2 million more cases of FGM will take place, and 5.6 additional child marriages will take place owing to the COVID-19 pandemic. And there's a few reasons for this: disruption to services, diversion of resources, the kind of exacerbation of existing inequalities, gender inequalities, racial inequalities that we're seeing throughout the pandemic, a lot of what our colleagues have spoken about on the call. Girls also experience high levels of sexual violence across many of the countries where research has taken place in this area. And I've given some examples just there. In these studies that have taken place, they're called the Violence Against Children studies, a really useful set of data. And what they show us is that not only do girls experience high levels of sexual violence, but they also very few of them actually tell anybody about their experiences. And even fewer still actually seek services, whether that's kind of case management or a safe space or counselling or phoning a helpline. And then those who do seek services, even fewer of those actually receive services. And so those who receive services, we're talking maybe 5 to 10% of all girls that experience sexual violence, which is obviously incredibly low and quite vital information to consider when we think about the scale of the issue. And lastly, just wanted to add this kind of final piece in Rwanda of women and girls aged 13 to 17 who reported ever having sexual intercourse. 46% indicated that the first incident of sexual intercourse was unwanted. And so you kind of get a sense of the scale of the issue there. And I also wanted to add that in so that we can begin to understand the nature around how people understand their experiences of violence, and that sometimes girls who experienced forced sexual intercourse might not understand that that was sexual violence and might not tell anybody about it because, as we've spoken about, it's very much normalized in all societies, I would say. And that leads to kind of chronic underreporting and lack of services available for it. And so this data obviously shows us that girls are experiencing various types of violence from very early on in their lives. And it also, just want to point out that these types of violence aren't happening in distinction from each other. If a girl is married at the age of 13 or 14, it's incredibly likely that she'll be at a much higher risk of experiencing forced sex or intimate partner violence later on in her life. And so a lot of these types of violence intersect and kind of perpetuate the issue. So I'm just going to move on to the next. Oh, there we go. And so kind of stepping back from the data and thinking about, the girls themselves that experience gender-based violence. Plan this year spoke to a number of hundreds of girls across 12 different countries about the Beijing Declaration and Platform for Action, because it's the 25-year anniversary of the document, and it's a very monumental document, sets out a very kind of ambitious agenda for achieving gender equality. And so we asked girls what their thoughts were on the agenda, how much progress has to be made, where are the gaps? And of girls across every single country that we consulted in, 73% of all girls said that gender-based violence was the top issue in their life. They described it as kind of an inescapable feature of their daily life. And there was a couple of things that really stood out for me in terms of the scale of the issue. Firstly, the impact of, firstly, girls experience violence in every single area of their lives. They were telling us it's in their homes, it's in their friendships and relationships, in their communities and in schools. When they use public transport or walk in the streets, they're experiencing violence of some kind. And secondly, the impact of that is felt in every single area of their life. And the reason they identified it as the top issue is because they felt as if it hindered progress in all other aspects of their lives. There couldn't be, for example, progress in their sexual health or their economic opportunities because they would experience violence at school or in the workplace, or experiencing violence within their relationships, etc. And so I wanted to just add that in because it was really stark and striking for me. And I think it's important to consider these types of qualitative data as well as the kind of quantitative stats, because it can almost sometimes just we need that perspective, you know, we need kind of to consider both angles. And so just thinking about the causes and consequences of adolescent girls experiencing gender-based violence, there's been some really good kind of overview of the drivers in previous presentations, so I'll try not to duplicate too much, but girls are very much at an increased risk of violence as they reach adolescence and their gender roles become more defined, meaning, you know, when they reach puberty and they kind of reach the age where they're expected to perhaps take on more responsibility in the home or outside the home. It might be that they reach an age where in their communities it's perceived that that's the kind of process to becoming, to getting married might begin. We know that pervasive kind of harmful gender norms condone the use of violence to control girls' sexuality and limit their agency and decision making. And as I mentioned, we also know that girls fall through the gaps of prevention and response programs between those aimed at children, for example, child protection, and those aimed at women, gender-based violence. And this can also obviously cause issues for girls who need to seek services that are very unique and responsive to their own needs. And so what are the consequences of this? Well, as you can imagine, there's significant consequences on physical and mental health outcomes. A lot of girls who experience violence are at much higher risk of having suicidal thoughts and poor mental health. There's a direct impact on kind of girls and women's engagement in the labour force. Obviously, particularly if they're experiencing violence in the workplace, but there's also been studies to show that experience of violence in childhood and adolescence, particularly such as child marriage, can lead to girls and women earning much less in adulthood as their kind of peers. Unwanted and unplanned pregnancy, intergenerational effects of violence. And what I mean by that is if a girl experiences violence in the home when she's young, she is more likely to grow up and become a victim of intimate partner violence. And conversely, if a boy experiences violence in the home when he's young, he's more likely to grow up and become a perpetrator of intimate partner violence. So you can see how this kind of perpetuates a cycle of intergenerational violence. An impact on civic participation. Girls who experience violence are much less likely to feel as if they can have their voices heard, particularly if they're experiencing violence in places such as kind of decision-making spaces, you know, abuse online, where they're trying to kind of engage in these conversations and discussions, etc. And then obviously just a reminder that violence against girls of any kind is a human rights violation and also results in violation of a number of their other human rights usually as well. And so just moving on to the next slide, just quickly wanted to kind of touch on the fact that you know, girls are not a homogenous group and they experience violence and GBV dependent on their kind of, it's very important to take into account their intersecting identities. And so there are girls who are kind of most at risk of violence. Those are girls living in humanitarian settings, children and young people who identify or who are LGBTQI+, girls living in rural areas, girls affected by poverty. And there's a number of reasons for this, which I won't go into now because that's a whole other presentation in itself. But Plan did do some quite, do some research with girls in living in crisis areas. So that was in the Lake Chad Basin and with the Rohingya girls, and I can't remember the last place. Oh, in South Sudan, it says on my slide. So, you know, when we spoke to girls in these areas, it was clear that a lot of them felt incredibly unsafe. And what came out of those findings was not only did they feel unsafe because of the conflict that they were experiencing itself, for example, the presence of armed groups in their communities, but also that it had exacerbated stress in the home, meaning that they were experiencing violence from their parents, their partners, their siblings, their families, etc., that they hadn't before. And so they had this kind of double-pronged issue where they lived that was really beginning to affect, again, every aspect of their life. So just to think a little bit about how Plan is responding to GBV, I'm going to talk specifically about how we are responding to the kind of root causes, instead of going into our kind of detail on our work around supporting parents and caregivers and safe spaces and helplines and that sort of thing. I thought it would be useful to talk a bit more about what we call a gender transformative approach to our work, which we can use across programs for any kind of issue that we work on, but is obviously key and crucial to kind of implement this kind of approach if we're talking about gender-based violence, which is rooted in gender inequality and harmful patriarchal norms. And so what I mean by taking a gender transformative approach is that it aims to tackle the root causes of gender inequality and reshape unequal power relations. And it focuses not only on providing equal opportunities and outcomes for all, but on removing the barriers that keeps girls from achieving their full potential. And I always find this graphic super helpful. I think I first came across a similar one when I was studying health equalities, because it just very usefully sets out what we mean by all these different kind of terms that we use so often and how important the distinctions are between them. And so in terms of just thinking about elements of a gender transformative approach, I just want to quickly run through what we mean by that. And so Plan uses kind of 6 core elements to think through our programs that use this approach. Firstly, understanding how gender norms influence children throughout the full life course, meaning how does gender inequality embed itself from birth up until obviously adulthood, and what are all the different ways that affects both boys and girls, because we also know that boys are negatively impacted by this, by toxic masculinities and gender inequality, and how can breaking down those barriers really make sure that we obviously not only eliminate gender-based violence, but are able to fulfill other rights as well. Working to strengthen the agency of girls and young women, and I'll talk a bit more in a second about what Plan does on youth activism and advocacy, but girls and women's agency, meaning their kind of ability and confidence to be involved in decision making, whether that's at community level and local level or just in the household around economic decisions, reproductive health decisions, that sort of thing. Is essential. Obviously working with and supporting boys and young men to embrace positive masculinities and promoting gender equality is key, particularly when it comes to ending gender-based violence. Progress is obviously going to be limited if we do not engage boys and young men and really work with them to understand where their own internalized kind of biases and understanding of inequality comes from. Considering girls, boys, young women and young men in all their diversity, and by that we mean those who identify as LGBTQI+, or their SOGIESque identities. I can't remember exactly what SOGIESque stands for, but meaning their sexual identity and gender identity. Improving the condition and social position of girls and young women. And so obviously working not only with girls and young women and boys and men in communities themselves, but also advocating to ensure that the conditions around them and their social position is improved by legislation, policies and budgets. And fostering an enabling environment where everyone works together to support the journey to gender equality. So this might involve often intergenerational dialogues, a key, and in making sure that kind of progress is happening across kind of within families as well as just with one generation. And I just thought this visual was quite useful to understand kind of the importance of taking a multisectoral approach. It gives the example of a girl joining a girls' club, and although she gains leadership skills and gains courage there, we see kind of, you know, okay, if the family isn't engaged in intergenerational dialogues and isn't doing their own exploring and reflection of how gender inequalities are harming their children, then, you know, the outcomes are not going to be as positive as we would like to see them. And similarly, in this example, if local governments don't have the structures in place to support girls in decision making, or they don't have the laws and budgets and policies which enable gender equality, then the same issue will happen. So really just highlighting the importance of taking a multisectoral approach. And so one of Plan's kind of key programs that we work on, which takes a gender transformative approach, is called Champions of Change. And this is some pictures of a workshop that happened in Vietnam recently. So Champions of Change is a series of modules that happens, that is led with a group of boys and a group of girls. And they each reflect on their own kind of different areas. Girls talk about, you know, body confidence, sexual reproductive health, living free from violence, economic empowerment. And then boys really come together to do some self-reflection on recognizing privileges and advantages, again, unpacking toxic masculinities, and really beginning to understand gender inequality and their role in that. And then after they've done that reflection, that work, they come together to have this dialogue, and often in Champions of Change projects, an intergenerational dialogue will happen as well, where facilitators will really encourage the young people to work with their families and communities so that the change is long lasting and it is not just, you know, obviously for this one group of young people in this one project, but that the community really sees a sustained change in attitudes and social norms. So I wanted just to talk briefly as well about youth advocacy and activism, which is a big area that the plan works in. We've already obviously had some great speakers speaking about this before, but just wanted to play this short video. It's a couple of years old, but it just kind of shows what Plan does to support groups of youth activists globally. And I hope you can hear it. Let me know if you can't. Oh no, it's back.
We still can't hear anything, Joanna, if there is meant to be sound.
Oh, you can't hear anything?
No.
Might
want to share your screen with sound?
Oh, I don't know, because I can hear it. Oh, that's a shame. Okay, appalls. Sorry.
If there's like a YouTube link or something, you can put that into the chat. We can watch it
I
later.
don't know if there is, which is a shame. But anyway, I'll continue. You'll just have to hear me drone on a little bit more instead of how a great youth campaign is, which is a shame. But anyway, I'll do a quick description of the video for you and try and share it afterwards as well. But this was a video about our project in Malawi that was supporting youth campaigners on ending child marriage. There was basically, the law in Malawi was changed in, I think, 2015 to increase the age of child marriage to 18. But what our youth campaigners identified was that there was still a loophole in the constitution, which meant that 16 and 17-year-olds could still continue to be married if they had parental consent. And so they started this amazing campaign. And the government eventually closed the loophole, which was great. So it was a good win. And apologies for the video issues, but I will move on. Oh, no, there we go. So these are just some pictures of various youth activists that Plan supports in different countries and regions. So I just wanted to really kind of put these up and take a second to talk about why Plan sees youth advocacy and activism as so important, and how we try and support youth and girl-led organizations in their work on gender-based violence, but across a lot of different things. Although, as I've mentioned, GBV is a huge priority for young people. So we have here a youth activist who at the UN on the top left, and then on the right, it's one of our youth activists in Togo speaking at the launch of our Girls Get Equal campaign to different decision makers and partners. And then on the bottom, that's a campaign again in Malawi, I believe, when they were campaigning on street harassment. And so, as I mentioned, working with girls and young women is a huge priority for Plan, because it's particularly ensuring that they are heard and meaningfully heard in decision-making spaces at all levels. And so this might be local and community level, or it might be global, for example, taking youth activists and supporting them to engage at the UN. And we're really trying to shift how we work so that we are supporting kind of movement building with young people, making sure engagement is as meaningful as possible, and making sure that spaces where Plan has a voice. Obviously, Plan is a huge organization and it's been around for a long time and has, you know, obviously a fair amount of privilege in terms of global and regional spaces simply because of who we are, but really making sure that we are stepping back and giving that space to young people who are experiencing these issues themselves, but also, you know, doing the advocacy and activism in their community on these things, and who have the solutions for these problems as well. And so this is the kind of type of work that I've been trying to engage in more and more. And it is a lot of work to make sure that we're doing it meaningfully, as has been said in previous presentations, but hugely kind of crucial and important that this is being done, particularly in work to end GBV, where girl and youth-led organizations and girl activists are often kind of overlooked, underrepresented, very underfunded, despite the fact that they have that knowledge, they have the solutions, and they have the skills. And so I will quickly move on to just what you can do, which is simply something I threw together. So, and I feel as if our other presenters had a lot of great ideas on this as well. But I just, one of the first things I wanted to say was about informing yourself, because I know this sounds incredibly basic, but when I graduated from my undergraduate degree, I just ended up reading a lot, engaging in dialogues on this, speaking to people about it, and that's how I got passionate about it. And I know that when you begin to engage in those kind of spaces, and to begin to challenge yourself and your own perceptions around gender and gender equality and feminism and women's issues and gender-based violence, and you can openly have those conversations with others, it's kind of a type of learning that I don't think has been equaled in any other part of my life. And I think a kind of network like this, like Students for Global Health, is such an incredible kind of space for you all to engage in that as well. And would also say kind of extend that to social media, because there is just so much to be learned on there from different activists that are active on there and youth campaigners. So yeah, take action on social media. Again, you know, it's a huge network that is just they're kind of waiting to be engaged with. So whether it's just tweeting or posting something on Instagram, you never know how you can start a conversation or kind of who you can be connected with there. Join a campaign or simply just start one for yourself, which is not obviously as easy as I make it out to be, but you know, if you do identify an issue that, you know, is not already being, people are not already organizing around and you truly believe in it, then there's no reason why you shouldn't start a campaign. And there is also obviously in the UK particularly some incredible campaigns happening on GBV already, and some great successes that have happened over the past few years as well. I would, as I just mentioned, very much encourage people to support girl and youth-led grassroots movements who are working on gender-based violence, because of that situation where they are very much underfunded and undervalued, particularly in the kind of international space where a lot of money is diverted to either UN agencies or INGOs, and it's really a trickle-down effect through various partners of how these grassroots organizations are able to get money, and just ensuring that they have sustainable funding and kind of strong support is super important. And then just listening to girls and young women, whether that is on social or engaging in conversations or kind of reading and engaging with campaigns that happen in the UK that girls and young women are driving forward. It's so crucial to understand what's happening in their lives and their opinions about it. And so we'd definitely encourage that. And yeah, so it's 16 days of activism. So this is a perfect time to engage. There's so much happening on social media. I'm incredibly overwhelmed at work. So just go out and engage in campaigns. There'll be so many reports that you could read and different things happening and webinars to attend. So we just really encourage you to use this opportunity. And lastly, just a plug for Plans. Plans campaign is called Girls Get Equal, which, as you may have guessed, very much focuses on supporting youth movements, youth mobilization, and girls' access to power and decision making. And so our focus this year, which was launched on International Day of the Girl, which was last month, was free to be online, and how girls' kind of experiences of online harassment and abuse stop them from engaging in those spaces, you know, kind of in a way that allows them to exercise their agency, kind of have their voices heard on decision making, that sort of thing. And so there's an open letter that can be signed to social media companies advocating for an end to online abuse and harassment. We released a report where we consulted with 14,000 girls globally on their experiences of online abuse and harassment, which you can read. And also today we launched a new chatbot for tackling online abuse. Would be great if you could use and share. And so that's all from me. I'm sorry I've spoken for quite a long time. Would be very keen to take any questions, and obviously also happy to take any questions offline if that's also useful.
Amazing. Thank you so much, Joanna. That was super helpful. And also, yeah, we've also been overwhelmed by the amount of 16 days of activism and Orange the World that's been on our feeds, which is amazing to see. And, you know, if you guys haven't been hashtagging Orange the World and looking into all of these things, please do. I'm sure most of you who are here have been quite encouraged to do all of these things. And again, if you have any questions for Plan that Joanna can take, please do put them in the chat. Again, I'll give you guys like around a minute or so to think about any. We've just got an interest in attending more Zoom workshops in the future about these issues. So, you know, if you guys do have any more that, you know, you've planned yourself in the 3 organizations that we spoke to, please do put them in the chat and let them know. I think everybody who's here, please do follow these 3 wonderful organizations on their social media handles to know more information and visit their websites. If there are any questions, please feel free to raise your hand.
I've got one, Joanna, if that's okay. When you're doing advocacy with Plan, what are the hardest areas to work in? Like, where are the areas where it's like a political minefield for you to do work and the Plan kind of struggles?
Really good question. It depends on the context, for sure. So country level work, because we have many country offices that do their own influencing at national level, and they kind of experience various kind of issues themselves. But as someone who works at international level, I'll say the past 5 years particularly, sexual and reproductive health and rights is an absolute minefield, is a very good word to use, mostly because of the leadership of the US administration. You won't be surprised to hear. They have been incredibly well organized in creating a very strong opposition. And there's been things happening in the United Nations that have never happened in the history of the United Nations in terms of rollback on kind of agreed language and not being able to reach consensus on very basic documents, which doesn't sound like a huge deal, but actually is a very big deal for, you know, kind of how that is then implemented at regional and country level and the kind of disruption that it causes to international processes. So that's been really, really hard to navigate. And we are sitting with our fingers and toes crossed, hoping that the new administration kind of changes that a little bit. And obviously, GBV stuff is very tied into SRHR as well. So that's kind of compromised a couple of resolutions that have happened recently, which is a shame.
Yeah, and I thought it would be really interesting. Could you tell people who are here, because I think it's really interesting to know about how like funding impacts civil society's ability to speak about things, about the gag order with USAID funding. Could you explain to everyone what that was?
Sure. I don't know if you'll be able to do it slightly better than me, because I was not working for Plan at the time, but the global gag rule is essentially something that came in during the, I want to say the Reagan administration, and it has basically gone back and forth. So every time a Democratic president gets elected, they scrap it, and then every time a Republican gets elected, they bring it back in. Trump has brought in the most restrictive global gag rule yet. It's also called the Mexico City policy, and it's fairly complex legally, so would recommend looking it up if you're interested, because my description will not be very good. But it basically, if organizations accept money from USAID, which is obviously a huge international donor, they cannot then provide abortion services. But if they also give money to partners, those partners are also gagged, so they also can't give abortion services. But Trump has made it so that it's much wider than abortion, and it's more broad sexual and reproductive health services. And with that obviously comes, I mean, you're talking about, you know, partners not being able to hand condoms out to people in communities, you know, that's the sort of thing that happens. And so, and it also kind of creates a lot of confusion on the ground as well as to what you can and can't talk about, which means that people kind of move away from even kind of working in that area anymore. And there's been research already about the impact of Trump's global gag rule in countries in Southern Africa, I think, and really interesting. I can circulate if useful, because it's already had just a huge impact on number of unwanted and unplanned pregnancies and access to contraception and things like that. So yeah, thank you for bringing it up. That is a really good example of, yeah, just a bad situation at international level.
So Charisma, I don't know if you can see in the chat, but people can't access the Google form, so you might just need to change the setting.
Yeah, we had another question. So this was, what differences do you find in girls' experiences of inequality and violence between different cultures and regions? So higher income versus low middle income countries, etc.
Another good question. So Plan works in 4 regions: Latin America and the Caribbean, West and Central Africa, Middle East and East and Southern Africa, and Asia and the Pacific. So quite broad regions, but the way I engage with those regions as somebody who works specifically on gender-based violence does change quite a lot. For example, in Latin America, sexual violence has been a huge issue for them, particularly during the pandemic. The numbers of girls that were experiencing sexual violence in the home just increased. Sexual violence and femicide in Latin America is already a huge issue, and it just got so much worse over COVID. And that's a very big issue for them. And they will also talk about child marriage a lot, but in the context of unions, because often girls will get married, but it'll be kind of a more informal union that will take place, which also kind of alters the way that we prevent and respond to those things. And then, yeah, similarly, as you say, girls in humanitarian settings, you know, kind of how they experience violence with kind of presence of armed groups and the breakdown of societal structures in terms of health systems, social protection, social kind of welfare services will be hugely different to development settings. And then, you know, in Asia, we have kind of trafficking is a much bigger issue, and online abuse and exploitation as well is a much bigger issue than in other countries and regions. So definitely varies a lot between not only kind of the types of violence, but also how girls experience those types of violence. Yeah, I hope I could go into a lot more detail, but I hope that's helpful.
I think that's a very good explanation, and also really good to hear about all the different experiences as well. Thank you very much there, Joanna. So in terms of the feedback form, guys, if you have been able to access it, can you please react with a happy emoji, either a thumbs up or a celebration, so that I can see who still needs access. You can use that using the reaction button at the bottom, or you can put a thumbs up in the chat. Okay, so a few of you haven't been able to access. Okay, so what we'll do is, if you guys can just share your email address with us in the chat box, and then we can send that to you via email, and so you can fill this in your own time, just to make it easier for us. Brilliant, thank you guys. Thank you to everybody who joined us. I think I've done this a little bit differently, where I haven't actually told you guys who we are until the very end. So thank you very much for sticking around to let you know who we are. So you've heard from, Plan, from YACT, and also from SVRI. So let me just introduce ourselves. We are Students Global Health. We are a UK-based national charity with some roots internationally as well. And we mainly work on tackling, our vision is for a fair and just world in which equity in health is a reality for all. So anything that would come under the global health inequality world, inequity, health justice, we like to think we are happy to advocate on and will make our voices heard on. And of course, violence against women, girls' rights, human rights comes under that. So thank you very much for everyone who attended. So that's who we are. Please do follow us on Twitter, Facebook, social media. Our website is www.studentsforglobalhealth.org. And once again, thank you for attending the workshop and having listened to our 3 wonderful speakers today. And if everyone could please react with a reaction emoji of some claps, or even put your hand, videos on and do some claps for all of our wonderful speakers, that would be amazing. Even though it is online, we still want to interact and let people know that we've enjoyed it. So thank you very much to all 3 of you for sticking around till 8, and also providing such an amazing presentation and sharing your work with us. So let's keep on oranging the world, everyone. And with that, we will conclude our workshop.